The Missouri primary will be held next Tuesday, and News 4 is highlighting some of the big issues voters will be asked to consider. Amendment 2 will be on next week's ballot. That's an Obamacare Medicaid expansion bill that supporters say is the way to make sure more Missourians have access to health care. Opponents say there's not enough money to pay for it. News 4's Samantha Jones breaks down both sides.
Chances are you've seen the ads.
Vote yes on Amendment 2.
That's a Medicaid expansion bill. It would expand the eligibility requirements in Missouri under the Affordable Care Act guidelines, which includes people between 19 and 65 who make 138% of the federal poverty level or less. Translated to make sense to your bank account, that comes out to a yearly income of $17,608 for an individual or $36,156 for a household of four.
Is a massive tax increase that Missourians cannot afford.
Republican Governor Mike Parson told News 4 in June expanding Medicaid would cost the state $350 million, a burden he says the state budget can't handle.
At a time when our state is undergoing a major health, economic, and budget crisis, we need to know exactly where we stand when it comes to a massive spending initiative for Missouri.
Other opponents, including State Senator Bob Onder, who represents the Lake St. Louis area, have warned of budget cuts elsewhere and say Amendment 2 puts Missouri on the wrong path.
Missouri cannot afford Amendment 2. Amendment 2 doubles down on a broken system. It moves us further in a direction of government-run, single-payer health care, a direction that Missourians don't want to go down on.
And when the health of our communities is on the forefront, supporters of Medicaid expansion say access to health care is more crucial now than it's ever been before.
To expand Medicaid coverage for the thousands of veterans who've fallen through the cracks.
A spokesperson for the Yes on 2 campaign said in part, Amendment 2 will help keep rural hospitals and urban clinics open by bringing $1 billion of our own tax dollars back from Washington instead of going to the 37 other states that have expanded Medicaid. This map shows where in the U.S. Medicaid has been expanded, many since 2014. Democratic challenger for governor and current state auditor Nicole Galloway says Medicaid expansion will not only provide more access to health care, but also create more than 16,000 jobs per year.
It is going to pass because people want affordable, accessible health care.
Samantha Jones, News 4.
If passed, the federal government is expected to cover 90% of the cost, with the state responsible for that $350 million. There are no direct impacts to Missouri taxes written into the language of Amendment 2. The issue will be on the ballot on August 4th.